national mental health program in collaboration with the Ministry of Health, with support from the Africa Center for Disease Control and Prevention, has conveyed a high-level international engagement in testifying its course for mental health legislative reform in the Gambia. The high-level stakeholder engagement conveyed at the Bakadaji Hotel in Bijilo drew together delegates from across the West and East Africa, Gambian health professionals, policymakers, and representatives of the judiciary. Mam Jara, Program Officer of the Mental Health Program in the Gambia, highlights the importance of the gathering as it serves as a viable opportunity to ensure policies are adopted to help ensure the drafted mental bill progresses to Cabinet and subsequently to the National Assembly for enactment.
Also, to ensure that our laws and policies reflect and are here to help the persons that they were designed for. For over a century, the burden of mental health in the Gambia has been addressed and governed by a legislation that was first written or drafted and enacted in 1917. It was last revised in 1964. This legislation on Mental Health Act, known as the Lunatic Detention Act.
She, however, identified existing barriers that continue to impede its enactment to be forwarded to the legislative level for review.
And in 2024, we did the situational analysis. By 2025, we launched the document. This document demonstrates that around 768 million people are affected, and through that, there is so much economic burden. But again,
Dr. Momodu Tinyasi, Director of Health Service at the Ministry of Health, described the high-level engagement as a joint commitment in advancing mental health as a core pillar of health, human rights, and development in countries across Africa.
Our presence here reflects a shared commitment to advancing mental health as a core pillar of health, human rights, and development in our country and across African region. Over the past years, the Gambia has taken important steps to strengthen its mental health system. We have developed a national mental health policy and initiated a comprehensive process to modernize our mental health legislation. This bill is designed to protect the rights and dignity of people living with mental health conditions, to protect.
Also delivering his remarks during the day-long engagement, Mr. Nathan, World Health Organization representative, underscored how mental health survivors continue to face severe exclusive stigma and discrimination and confronted with barriers in pursuit of accessing quality health care.
A long time ago to be completed as soon as possible. Today's gathering represents more than a discussion on a piece of legislation. It represents a collective commitment to ensuring that mental health is recognized as a fundamental part of health, human rights, and the well-being of every Gambian. Whenever I have to talk to people about mental health, I say all of us have mental health challenges. The issue is the degree of severity and the type of support we need. But all of us, including the speaker, have mental health challenges. Mental health affects individuals, families, communities, and societies. Across the world, millions of people living with mental health conditions.
He added, such challenges are an indication that mental health cannot only be addressed through mental services, asserting that they require to be confronted through robust policies, supportive legal frameworks, sustainable investments, and society approach.
Across the world, millions of people living with mental health conditions continue to experience stigma, discrimination, exclusion, and barriers to accessing quality care. These challenges remind us that mental health cannot be addressed through health services alone, It requires strong policies, supportive legal frameworks, sustainable investments, and a whole of society approach. Dr. Mohammed, thank you so much for that passionate appeal to let all of us know that it is a public health issue that requires all our involvement. We should stop medicalizing a public health issue. So thank you so much for that. For the Gambia, the development of the mental health bill marks a significant milestone in strengthening the country's mental health support system. This bill provides an opportunity to establish a modern and
The authority stated the development of mental health bill will mark a significant milestone in strengthening the country's mental health system, provide an opportunity to establish a modern and rights-based framework that protects the dignity of individuals, promote access to quality care, strengthening accountability, and ensure people living with mental health conditions receive the support they deserve without fear, discrimination, or neglect. For the Voice TV, I am Jenki Kujabi reporting.